Good.
All right. Well, welcome, Danielle Kiesler, to our conversation. I so appreciate you doing this for me and my class, who's going to get to learn from you. So I thought we could start with you talking a little bit about your practice and how you got here, your education and all of that.
Absolutely. Thank you. And thank you for having me. And I love talking about this stuff because so depending on how much time we have, I could go on and on about how I got into the somatic stuff. But, I came in from a love of art and expressive arts and thinking maybe I needed to decide between being an art therapist or being a dance therapist. I couldn't decide. But I had this really opening experience when I was like a teenager where I just felt like my sense of who I was shifted through dance, from a small kind of anxious, contracted self into something larger. And I know many of us have experienced that in different ways. And I just, from that experience, have just been on a mission of trying to understand what that experience was, what it is when I have it again, and helping other people, just knowing the power of the body, knowing that the body is the key to a lot of things, mental health, well-being, and just wanting to help people be in their bodies more.
Right.
So that's where I came personally, and then professionally, I started teaching creative movement. I started teaching yoga, Pilates. I went probably 20 years ago full tilt into exploring all the kind of body-mind modalities that are out there. And so I was kind of like I think you might be this way too. I don't know, kind of an education junkie. I
am that way.
You're that way too, right? I just took like anything that was out there that had body mind in it. I wanted to know about it and to learn it.
Yeah.
And so I'm still on that path.
Yeah.
And that's what led me to ultimately to sort of back up. I had a practice as a yoga and Pilates instructor before I became a psychotherapist. And so working with people on the table, on the mat, it became quite clear to me that it wasn't enough just to put people in their bodies, right? Because what happens when you do that is trauma comes up, memories come up, emotions can come up. And so I was really fascinated by that and really curious about how do I work with that? And so that's what led me to somatic experiencing. And then also I went to graduate school and studied somatic psychology, which was kind of a new thing then.
Oh, fascinating. So where did you get your master's degree at?
So I'm from San Francisco Bay Area, and they have, it's now called the Sophia Institute. Back then it was called Institute of Transpersonal Psychology. And I feel like on the West Coast, there are a lot of these integrative schools that take more of an integrative approach. Naropa is in Colorado because it's very similar to that. And so I went there. And it was a 3-year program. We did not just somatic work, but we did expressive arts as well, which also obviously interested me. And they had a pretty good marriage and family therapy program. So I got my license as a marriage and family therapist, working from a systemic perspective, but also knowing that the body is a system too.
Right. Yeah. There's sort of that internal system.
Exactly.
Yeah. Wonderful. So you studied there. It sounds like it set you up for this kind of work because of the focus of the program. I imagine the kinds of experiences you got to have, the kind of education you were exposed to, that kind of thing.
Yeah, totally. But, even with all that experience, I mean, SE for me was the thing that kind of pulled them all together in a way that made sense.
And by SE, you mean somatic experiencing, right?
Thank you for spelling that out. Yes. Somatic experiencing, Dr. Peter Levine's work. And it's just a really lovely way of understanding how to work with people from a, biopsychosocial model.
Yeah. So the somatic experiencing like education, I mean, what I have heard from folks is usually that kind of extended education happens after graduation. Did you end up going and getting like fully certified and going through, I imagine, hours and hours of training and education?
Yes. Yeah. So so if I look at the order of it, I graduated and I was sort of saving up money to take that program. If I were to do it over again, I would have, if I had the money to do it, I would do it while I was in grad school, so I could just like have that. I ended up working in a hospital for a period of time, and that was pretty intense. And I think that model works really well with everybody, but I wish that I had had that learning before I worked in a hospital setting.
Sure. Yeah. Because of, I mean, so much of the medical model is just hyper focused on the body, but from a very different lens, from what I can tell from somatic, it's sort of
Exactly.
very medicalized, absent of mind body connection, that kind of thing.
Right. It's all about identifying symptoms and addressing those. Right.
Yeah.
So it's it's not holistic at all.
Right.
So I felt it was a shock to me to be in a system like that, and then realize, coming from a holistic education, a holistic school, that not everybody saw it the way that I did, was actually very eye-opening for me.
Yeah.
It was really helpful too to see, be able to talk with doctors and nurses and be able to speak that language too, and then translate it. And being able to speak both languages, I think, is really helpful.
Yeah. I imagine, and when you say translate, do you mean translate for yourself or for them to kind of help draw the parallels in some way for them?
Yeah, both. I mean, I think at that point in my life, being a newbie in the medical field, I wasn't out there to change the medical profession per se, but I felt like I did my part. And so I had to first translate it for myself, knowing how does this, what I'm hearing and seeing, translate into what I know is true for people and what I know is true for healing, and what's possible for this person in front of me. And then thankfully I had some supportive peers who also were really open to how I saw it. And so I had a really great supportive boss who let me basically start my own program in the hospital setting.
Oh, wow. Okay.
Yeah. So I started a couple programs that were body inclusive.
Okay.
Yeah.
Like when you say programs, what came to mind for me was like mindfulness programs or some kind of something like that, where you engage patients to sort of make that kind of mind body connection, or?
Yeah, well, so I worked at that time, I was working with children and families in the hospital. So I created a program called Emotions and Motions that was for kids. That was very playful. It was very movement based. It was very active. And so there was a little bit of mindfulness, but only after we had done a lot of that play stuff. And it was really about helping them to understand their unique nervous system in their bodies, and to be able to start to regulate it and to give them language to talk about it.
Yeah.
And so that was one part. And then there was a parent portion, which was the same goal. Right.
Yeah.
And then I did another program, Reclaiming Our Bodies for Women, which was adult women. And that was more gentle, mindfulness based, and it incorporated a little bit of expressive arts into that.
Yeah.
Yeah.
That sounds wonderful. You should come do that here at SLU. Because I think we were actually just talking this semester in my class about like working with kids and parents and how do you help them understand emotion. And there's lots of interventions around like helping parents become emotional coaches for their kids. That and also coaching themselves right through those moments. So I imagine maybe your program did some of each, or how do you kind of approach that?
Exactly. Well, it's so important. And I have to say, I have a little beef to pick with some of the parenting
Yeah,
um, programs,
please do.
if that's okay
Yes.
to. And a lot of parenting programs are really helpful. And in my experience, they assume something that isn't true for a lot of parents, which is they assume that parents are already regulated.
Yeah. Oh,
And right.
yeah.
I know that's not been true for me as a parent at times. So because of that, it can set people up for failure unintentionally, right? If you're assuming somebody is regulated and they're not, and then they're going to go teach regulation to their kids. So, there's a place for that. Absolutely. But I think long term, which is what I'm interested in, how do we help families? How do we help parents and kids, co-regulate, self-regulate? Yes, let's start there.
Mhm.
Both, and that might look differently for parents than it does for kids. It might look differently for different nervous systems, right? And then how do we co-regulate together?
Yep. Yeah. Yeah. But step one is the parent getting a sense of themselves and what they need. Otherwise, the whole thing falls apart.
Absolutely.
Yeah.
Absolutely.
No, I agree with your beef. That totally makes sense. Because I do think sometimes we skip over that step. And yeah, I'm sure that my experience of parents is they're very concerned about the kid. They're very focused on the kid, the symptoms of the kid, the behavior of the kid, and there isn't as much of that awareness of self.
Right.
Yeah.
Right.
Yeah.
And
Wonderful.
that's true with couples too, as you know.
Totally.
Right? We're so focused on what our partner is doing or not doing, and we have no awareness of how we're influencing that system on a nervous system level either. And so, yeah, in dyads, that's just unfortunately true.
Well,
Right?
and especially when it's, there's distress and conflict. It's you're focused on the conflict and that other person and what's wrong with them, and you're less concerned with how am I contributing? What you just said there, sort of what is my part in this?
Yeah.
Certainly. Yeah.
And
So
then to bring it back to the body, how does my body to tend to respond to stress? What do I know predictably? And what does that tell me about what my body needs, both in times of stress, but also not?
yeah.
How-
Yeah. So one of the big questions, and maybe we're getting to that with what you just said, is sort of your approach to somatic experiencing sort of I mean, let me say this. One of the things we've been piecing apart with my grad students is the difference between a whole like theoretical approach and then a particular intervention.
Yeah.
And so maybe walk us through kind of your approach and maybe within that, if there's particular interventions that you rely on.
Yeah. Well, I appreciate that you distinguish that. Yeah, because somatic experiencing and many somatic therapies are a whole approach that encompass a lot of interventions within them, right? And in SE, somatic therapists are really obsessed with what is a healthy nervous system? How do we recognize that? How do we feel it and recognize it in ourselves? This is very self of the therapist in its approach. But then also, what are we seeing and noticing and experiencing in another person's nervous system that's sitting right in front of us? And then what's happening between those two, right? So there's a whole training, and the SE training is 3 years if you go through the whole thing. So it's pretty intensive.
Yeah.
And part of it is just really getting to learn how to see and read nervous systems. It's a whole different ball game than what one learns in psychotherapy school, at least what I learned, even though I had the somatic emphasis. Learning to read nervous systems and be able to have language for what I was seeing and understand that is a whole thing.
Yeah, well, you're making me think of the research that talks about how so much of what we feel is not terribly visible. And so there's this awful statistic, and I'm hoping to God it's not true, but I think it's true. 10% of emotions, 10 to 50% of emotions actually show up on people's faces, and the rest sort of stay under the surface. But I have to imagine when you're trained in this kind of approach, you can look for more subtle clues or look for more, beyond the face and emotion that are the rest of our body is also giving off clues. Is that fair in terms of
Absolutely, absolutely. And we know that most of our experience is unconscious. There's non-conscious, right? So we're giving off signals whether or not we know it. And I like to think of it, of course, this is my original training, is in movement. I like to think that everything is movement. And so if I think of it in that wide and lens, it's not just about what's showing up on people's faces, but how are they in their bodies, through gross motor movement patterns, but also where is their constriction or not?
Yeah.
Where is their movement or not?
Yeah.
Where is their breath or not? Where is their color or not? Right. And so that opens up a whole repertoire of ways we can assess, but also intervene once we have that information.
Yeah. You're making me think of that classic quote that probably all of us heard in grad school. Not communicating is communicating. Right. Not moving is movement. Like there's a message in the constriction, in the not movement, in the stoic faces, or in the sort of steeled body, that there's a message there. Is that fair? Is that similar?
Absolutely. Yeah. There's a message there and a story, and probably something that is needing to complete on a nervous system level, that's looking for completion, that if the person knew about it, they wouldn't have to carry that constriction, and we're able to complete that in competent hands in the presence of a therapist. There wouldn't be the need for that armoring or constriction. That's the hope, right? There would be movement and liveliness again.
Yeah, you'd almost see the relaxation as the body sort of, I'm almost like unwinding now as you're talking.
Yeah, totally. I know. Isn't it interesting how just talking about it stimulates it? Yeah. Totally.
Oh yeah, just relax. Stop.
Yeah.
In your neck. So the approach is about, this is reminding me of the Peter Levine video about sort of getting the body to open to movement and to begin to move in a more natural way. And so within that, you said there's a story in there. Is there a processing then of the constriction in terms of a verbal processing, or is it something else?
It depends, which is an unsatisfying answer for some people, but it's true because it is so complicated. Sometimes the story is helpful, sometimes it's not.
Okay.
Sometimes the story actually gets in the way of people being able to process what's underneath that, which is the physiological response.
They get caught up in the story.
Get caught up in the story, or maybe I've told the story so many times that parts of it aren't actually true.
Yeah.
Right. And then that becomes, it's a different kind of constriction pattern.
Yeah. Well, I'm almost thinking about like old stories, right? Where retelling is about constructing the meaning, but may not tell the real story, and the meaning itself is problematic. I don't know if
totally. So this like stories we tell ourselves about ourselves often that are not true, or about other people, right? Old stories. But I think stories, I love stories, and they can be helpful. And we're, as a somatic therapist, I'm always interested in, does the story match what's happening in their nervous system, in their physiology, or does it not?
Yeah.
And if it doesn't, then I'm curious about that.
Yes. You're making me think of a case I had once where we do in sex therapy, we do sensate focused exercises with couples, which is a very somatic experience for them, in the sense that it's body driven and there isn't conversation. and it's about watching the body react to the touching that's happening. And there was an experience where one of the partners was saying something in session, and then when they went to do the exercise, her body told a totally different story.
Yeah.
And I went, oh, like, oh,
Yeah.
okay. What do we do with that?
Yeah, that happened to me all the time when I was a Pilates instructor and I had to work with people on the table. And fortunately, in Pilates, I mean, now you remind me of the story. You know, the protocol was to help people feel their pelvis first and to go directly to their pelvis, which, you know, somebody with sexual abuse history, you wouldn't go there, right? So what would happen is people would go into a freeze response. Right? Or they would shut down, or there would be bracing, and that's like the opposite of what I think. That's the opposite of movement. That's the opposite of healing. That's not what we're going for. So that's partly where I got curious about SE too. When you notice that somebody is in a freeze, what do you do?
Yeah.
What do you do with that? And freeze is like one of the harder ones to work with.
Yeah. Because you're calling them out of something very protective.
Yeah, and maybe there isn't a need to call them out in that moment, but it might just be more for the therapist to know, you know, there's a defense here that needs to be worked with first before we can go even further. Otherwise, we're just reinforcing old patterns of defense.
Yep. Yeah, no, that makes sense. That makes sense.
Yeah.
So I have a couple of questions from my that I had put in that email to you, but one was about, you know, I think they came into like watching the video on Peter and getting interested in this, and they were sort of shocked by what they saw, because in their minds, they're used to talk therapy. You know, they're used to, I mean, lots of systemic approaches, right? Where there's a bit more direction happening, or it's very verbal, I guess, for lack of a better word. So they found that they had misunderstood kind of what they were walking into. Do you have a sense about what people typically misunderstand about somatic experiencing as an approach?
Oh, that's a juicy question. Yeah. Well, it's interesting. I had a different answer to that question when I first read it from you than now, as I'm hearing you saying it in this context. So I'm debating which one to answer here.
One works. For both.
I think the thing that people can get wrong about SE sometimes is they assume that it's we're just working with the body, right? And that's all we're doing, when actually it might look like that, but we're also working with all the things that are part of the therapy toolkit, you know, thoughts, feelings, behaviors, but we're going more in depth in the behavioral component, so that we're really interested in things like sensation and impulse, right? Because what happens is and that's necessary to go there, because what happens is, as therapists, often we want to we love our interventions, right? And we want to take action, we want to help people, and we want to fix their problem. But sometimes we rush in there too soon.
Yep.
And we want people to have good boundaries. We want them to take a stance, or we want them to have a voice. But if people aren't in their bodies yet, they're actually not ready for those big energy states.
Sure.
And so it's kind of like, water off a duck's back. The nervous system doesn't actually take that intervention in, or it might take it in for a little bit, but then it'll spit it right out.
Yes. Now you're making me think of a client.
Okay. I know we could have a whole session about clients.
Consult is what we should do. Right? But you're making me think of those moments where I find myself saying, I feel like I've said this already, or I feel like I've done this already. And it's like Teflon. Whoop.
Yep.
Wait a minute. Let me try that again. Whoop. And even when I think I've sort of emotionally affected someone, it's like it gets thrown off.
Yeah. Totally. And there's a reason for that. And that's, and a lot of times people aren't even aware that they're doing this. It's non-conscious.
Totally. Yeah.
Right? So that's where, being able to work in little small, manageable ways for that person with the non-conscious material in a way, and bringing it to conscious in a way that's manageable for them, that's not overwhelming, that doesn't send them into another defensive response of fight, flight, or freeze. So powerful when you can allow people to do that. And then it sets the foundation for them to be able to do a whole lot of other things.
Yeah. It seems like the micro movements are quite small. And I see,
here they are. Not with everybody.
yeah. I guess I'm thinking about I'm thinking of what you're saying, and I'm thinking about sort of what we saw when we watched Peter work, which was seemingly small movements. They had a big impact in the end, but it's slow and deliberate, it seems.
Yes.
Does that sound fair?
Yeah. And often it is, although I have to say, not with everybody.
Okay.
Yeah, some people need to work big first before they can work on that subtle, level. And for some people that, working more subtly is ultimately where we're going, right? Because that's how we can, we want to be able to affect the whole system and not just the obvious macro, macro movements.
Yep. Yeah.
But yeah, a lot of the training is really fine-tuning enough what you're seeing so that you can intervene really skillfully, even through conversation, and it not having to be a big deal. You're not having to have people, jump up and down and do jumping jacks, although you might do that as a way just to get people in their bodies. I've done that with some people who just don't have a sense of their bodies. We might work big initially.
Yeah.
Until they start to feel, okay, I know what this is. I have a body and I might be able to actually work with it or tune in a bit to it at times. And then at times not, right? And so we're doing this dance between, what people are up for, what their capacity is, and where we see their nervous system, what their nervous system needs. And Peter's really good at working skillfully with these more subtle, on the one hand, there's this kind of subtle way of working with micro movements, like you said, breath, gentle impulses that have not fully formed into a movement even. And on the other end of that same movement spectrum is these larger, maybe more cathartic experiences.
Yeah. So maybe this answers the next question about sort of how to work with clients who just aren't used to being in their bodies or talking about their bodies. Is that one sort of possible intervention, is the make it big first to kind of like jolt them back in to some?
Well, it depends. Again, it depends. Yeah, it could be. I like to see where somebody's at. Some people will say, close your eyes and go inside. Now, what do you feel in your body? And for some people that can work, but for many people, that's too advanced of a skill. They don't have that awareness yet to even know, and then so they'll say things like, well, I don't know, or I don't feel anything, or what am I supposed to feel?
Yep.
Right. And that, yeah. And then
yes,
that's then that what tells me, oh, we need to work on them befriending their body first. And so for a lot of people, that's my primary goal, is can they befriend their body, not just know that they have a body, but actually befriend it. So they have a particular kind of relationship that's friendly, that's not evaluative, that's non-threatening. And for many people, that is the goal. We work on that goal for quite a bit.
I have to imagine it's a really hard goal for a lot of people.
It's a hard goal. And sometimes, so there's a lot of ways that we can help people befriend their body, depending on what that person person's nervous system is doing and what their personality is like. We might work big. I might have them, get up and let's move your arms, right? Let's move our arms together, right? So they're not feeling ridiculous, like I'm sitting there watching them. So we're doing this together. And we might do some self-touch, right? As a way, they're all different interventions that we can do to help people just start to feel, okay, I do have a body and it feels safe enough to go there.
Yeah.
At least in a small amounts. We're not going to be doing this the whole session.
Yeah. But it sounds almost like you're kind of reintroducing them to their body to some extent, what it feels like and what it does. And because I think we were actually just talking about this in class about how we, thanks to the what Emily Nagoski calls the bikini industrial complex, that is the diet and nutrition and body part of our capitalist society, sort of engenders this idea that if your body doesn't look a particular way or feel a particular way, it's not your friend. It is something to be fixed. It is something to be changed.
Right. And so we're healing a collective trauma in doing this work, right?
Oh, yeah.
We're healing this collective trauma of disembodiment and patriarchy. And we could name probably a host of others, right?
White supremacy. White supremacy.
White supremacy, absolutely. Right. We could have a whole conversation about that. But, at its foundation, it's like we've all been trained to look at ourselves from the outside in versus from the inside out. And so when you can teach somebody, first of all, some people need some buy-in. And so they might need some psychoeducation, why it might be a good idea to do that.
Yeah.
But once there is buy-in, being able to experience for some people for the first time and claim this body from the inside out versus from the outside in is a radical shift. I mean, that's just a game changer for a lot of folks.
Well, what I'm thinking about is how, we must train that out of people, because my children, when they were younger, had no problem starting with their own bodies and expressing a need, a desire, an impulse. My youngest does gymnastics and she randomly is in a handstand somewhere, right? Like, sort of, it seems like babies begin there and then we train them out of it in order to perform or be a particular way. And then your work sounds like we need to go back to what you've always known.
Absolutely. So that's a really important point. Like, we have always known this. And so deep down in us is still that knowledge. But a lot of times it needs waking up. It's gone dormant for a number of reasons, because of trauma, because of conditioning, because of, a lot of things. So it's there. But it might have gone underground. And so it's really a question of how do we notice, how do we know that it's there, not just intellectually, but how do we actually sense it, see it, feel it? And how do we help, both as a practitioner, how do we do that? But then also, how do we help other people do that same thing?
No, that makes a lot of sense. So from your experience, then what's the typical kind of client who walks in to see you and this works well for, who might need something else first, or maybe this just isn't a good fit at all? What have you noticed?
Well, I'd like to think, and this has been my experience so far, that it works for just about everybody, but it might need tweaking for certain folks. Yeah. So certain folks, we may not start with befriending the body. Maybe they need to be in their head first for a while. Right. Maybe we need to spend more time doing some DBT, right, in order to stabilize, or just doing psychoeducation to stabilize before then we enter into the trauma vortex that's held in the body.
Yeah, because there's the possibility of the dysregulation you talked about earlier, and going into freeze or going into something else that it
Right.
sounds like it's almost like scaffolding them into it.
Yeah, absolutely. So some people, I mean, and that's the code kind of goes back to what's the misconception about SE. We don't just put people in their bodies and we're not just focused on the body. We're always working with the whole person. And sometimes we might choose to start on one end more than the other, depending on who that person is and what they're dealing with. But for most people, you know, some form of befriending the body early on is actually really helpful in session.
I would think so. I mean, it would at least kind of set the stage, I would think, for this is a way of being, or this is like a useful tool as you're working through trauma or conflict in a relationship, that like your body has memory and experiences and needs that are important to pay attention to as you're sort of walking through this.
Yeah, and so sometimes the learning is just, and this is radical for a lot of folks, when they finally are able to befriend their body, can they experience it in neutral, even a pleasant way, you know, that's not overwhelming. That's a huge shift for a lot of folks. I'm sure you know about that too, from the work you do with couples and sexuality. That being able to befriend the body and not go automatically into a freeze or a flight response. Yeah, that's huge.
Yeah, there's so much judgment. I mean, you were actually just talking about this today. There's so much judgment for what we feel, for the needs we have, for the good or bad, or I mean, even like one of my students was talking about how they have all this self-judgment after they want to avoid homework. And I'm like, who doesn't want to avoid homework? Right? Like, but there is all this sort of stuff that we do to ourselves that doesn't allow us to sort of listen well. It just makes us want to kind of run away from it, or like pretend it doesn't exist or something.
Yeah. So oftentimes we're doing this dance between what is it that the physiology wants, that the person's nervous system wants, whether it's to get away, you know, and what does their personality want, you know, sometimes it's not the same thing, you know, and then that's a dilemma. And then sometimes that dilemma is at the heart of trauma, you know, so that's it can get pretty complicated fast, but also one of the things I love about this model is that it's a resiliency model, right? And so it's about creating resiliency in the nervous system. It's a growth model. It's you know, it's all those things. It's not just we're trying to fix a problem or even heal from trauma, although it's that too.
Yeah, it seems like the overarching message from like a somatic experience approach, like to a client, is you have what you need. Like, let's sort of get back into the body and find it, and help you get used to using it. You know, I don't know
what you need, but it might be buried. Let's help you find it, you know?
Yeah. Well, and maybe strengthen it, or like, like working out a muscle, like let's give it some practice and some support. Is that fair?
Yeah, absolutely. And, you know, SE always works in the present moment. So it incorporates a lot of mindfulness, but it's also different, I think, than just regular mindfulness, which we're not, you know, healing happens in the present, but we're not just letting our minds or bodies go wherever. We actually have an agenda here, right? And that agenda, and we have a particular places that we're directing people's attention and where they might need to go in order to move towards this path of resiliency.
Yeah.
So it actually can be pretty directive. A lot of people don't know that it can be, but a person's body and nervous system are doing what they need to do, if they are moving in the right direction, then the best thing, then we want to intervene less, actually.
Yeah. No, that makes, it did seem like, maybe that's one of the other misconceptions when you think about something like somatic experience in the body, that it's sort of free flowing and we go wherever, but actually it, based on what I've read and what I've seen, it looks like we're after a particular thing. We know where we're going and we're going to kind of help steer you, but it looks really gentle. I think
that's the art of it.
Yeah. That seems to be, it's directed. So my training is in emotionally focused couples therapy. And Sue Johnson is like an artist at this. There is a clear direction if you watch it, but her approach is so gentle.
Yeah.
Like people are just like nudged. And it seemed like Peter Levine and maybe somatic experiencing generally is that same sort of idea.
I love that. And I think there's something to that. I've heard from, I don't remember the exact statistic, but it seems like when you're at a masterful level in whatever approach you use, there's a way in which, I think there's some research behind this, you might know the research, that the people who are at this masterful level are actually doing things that are more in common than not. And so in other words, we have all these, we're kind of siloed in our separate approaches, but at a certain level, we are very finely attuned. We're doing some of the same things, but we might have different languaging or different ways that we're approaching it. Yeah,
I think that's totally true. I think that's true. And I still think we need like these variety of approaches, but yeah, I do think there's something about the directness sort of couched in a gentle approach that for people is easier to take in.
Yeah, absolutely. So people talk about stealth SE, where, and the way you describe Sue Johnson reminded me of that, where you might just be, from the outside, it looks like we're just doing regular talk therapy, traditional talk therapy. But actually, we're affecting nervous system process in this really stealth, gentle way without making a big deal about it, without naming it so much.
Yeah. Right?
We're still working in that somatic way.
Yeah.
But it's really gentle, like you said, or it's subtle.
Yeah. And I think there's so much. When I think about like traditional talk therapy, what people don't understand is there's so much that happens that isn't being verbalized. And it sounds like with somatic, it's maybe similar because it's about tone and it's about what we're focusing on. And it's about, it's sort of more subtle elements.
Mm-hmm.
You say that's the case too for somatic?
Yeah.
Mm-hmm.
Yeah. I agree.
Yeah.
And we might be looking at different elements there, but yes. Yeah. And it definitely includes that, the psychological processes and, the different parts of self.
Mm-hmm.
And
yeah. So we're getting to the end of time. And so is there anything we haven't talked about that you wanted to be sure to share sort of about somatic experiencing, about this approach and maybe other parts?
I think we covered it. I mean, I think this was great. We had a conversation, and so I guess I would just probably put a plug in for SETI, Somatic Experiencing Trauma Institute, if anybody wants to go and study somatic experiencing. And then if people have more questions, they can contact me too. Okay, wonderful. Well, thank you so much. I so appreciate your time and your expertise and sharing what you do. I think it will certainly help at least my grad students, if not anybody else, to sort of, think through if this is a good approach for them as they kind of consider what's next for them. This is really, really wonderful work. Yes. Well, thank you. I appreciate the conversation, and it was nice to chat with you.